That Omicron variant is now confirmed in all 50 states, and the rush is on to get tested.
The Polk County Health Department is seeing more people making visits for testing, vaccines, booster shots. The upcoming holidays appear to be the motivation. WHO 13's Taj Simmons joins us now. Taj, most testing locations are seeing more demand.
That's right, and that's on top of the already extremely demanding work for healthcare workers, which has been on the verge of overwhelming recently. The reasons behind that is COVID-19 patients who receive emergency care often take time to recover, and that leads to a logjam of new COVID patients in need of a hospital bed. That work to help them takes precedence over COVID-tested people with far less serious symptoms, and health leaders say it's now encouraged for those patients who don't have serious symptoms to find a testing site or kit far away from a healthcare facility.
If you are sick, then that's simple. You stay.
When it comes to COVID, knowing whether you have it or not is a big part of the battle. But Unity Point Medical Director Clint Hawthorne says you should think carefully about coming to the hospital to find out.
If you're feeling ill, then we're here. But if you're feeling like, okay, I just need to get a test, there's lots of places that can provide just a test.
He says doctors and nurses need to focus as much attention as possible on the COVID patients already in the hospital.
Almost a third or 25% of our beds are going to be allocated towards one disease entity. That really starts to limit the capabilities to provide care for everyone else in the community.
As hospitals focus on COVID treatment, other entities are filling in to diagnose Iowans ahead of the holidays. That includes Nebraska-based GS Labs, which operates a rapid testing site across from Valley West Mall.
There's still a need, obviously. I mean, our numbers are up 50–60% in the last couple of weeks.
GS Labs medical director Darren Jackson says that translates to about 300 tests at its Iowa site every day. He says they have the supplies to do 1,000 tests per day if there's a dramatic spike in demand due to the Omicron variant or the holiday season.
And these traditional holidays where everybody likes to get together, people want to be as safe as they can.
In this case, safety comes wherever you can find a COVID test.
The hospital system and primary care clinics cannot be the only place for testing.
And keep this in mind too. He said it doesn't matter where you find a test or whether it's an antigen or PCR test, but once again, he strongly recommended you take that test away from the hospital if your symptoms are not severe. He said in the past, patients have been referred to drugstores such as Walgreens or CVS or even Walmart to find those COVID tests because those hospitals just don't really have the energy to do that right now.
Absolutely. All right. Thanks for the update, Taj.